Well, Shayla, welcome to SalinaHomes podcast room. I'm Juanelle Garretson, as you know, and I am so thrilled that you were able to join us today to share about your company that you formed a little over a year ago. You can give us the background on that with Revive, and just tell us a little bit about what that is with Women's History Month. I'm so proud of you and your partner, Laura, for beginning a really needed agency, I feel, in our town, and tell our listeners what that's about.
Yeah, so Laura and I started Revive Integrative Health. It opened November of 2021.
Okay.
We both kind of started at a time in our life, which most people don't start businesses. I was just had a baby, and he would have been 10 months old when we opened, and then she would have had a 5-month-old, I believe, at the same time. So we kind of started all this while we were pregnant and getting ready to have babies. But we really wanted a place to work at that really focused on women and children, just because it's such an underserved population, specifically in Salina too. And then we created this company also because we really wanted it to be family-centered. So our own family is number one, as well as all of our employees. And that's the main thing we always talk about when we hire on new people, is that family does come first. And I do believe that Laura and I really stick to that as far as, helping our employees be successful. Just because we know if they have more time at family, they're going to do better at their jobs and treat everyone else better too. So we started with just 4 of us, because we had Laura and myself, and Laura does acupuncture and I do physical therapy. I did pelvic floor therapy as well as pediatric therapy. And then we had a massage therapist at this time, Heather Hemme. And then we had a front desk administrator that worked with us, Katie Adamson. And she's still with us. She's fantastic. So really it was 4 women got together and we kind of just started something great. And then Laura and I grew, and I think we're up to 17 employees now.
So tell me, help update me about some of the other kinds of services and or treatments that you can get at Revive.
Yes. So Laura does acupuncture, and so she does a lot with some chronic pain, but one of the really cool things that she does is called Mercier therapy, and it's for fertility. So she can do some acupuncture and massage to help get the uterus and ovaries ready for conception, and just help women with that fertility with some different hormones, kind of talking about what they need to look out for. So she does a great job with that. That's really unique, and I don't think there's that many people in the state of Kansas that provide that service, because she has people traveling all over the state to come see her for that. And then I do pelvic floor therapy, and so what that entails is, working with either constipation, incontinence, pregnancy pains, or any kind of low back pain with intercourse, anything pelvically I can work with, as well as pediatrics. My pediatrics is more neuro, but I do see some orthopedic as well. And then we have a pediatric occupational therapist that does a lot with autism and behaviors. She's fantastic with picky food and sensory eating. She really gets kids to expand their palate and just consume and eat a lot of different varieties of foods, as well as that emotional regulation too. She is also certified in lymphedema, which was a course that I think was 2 weeks long, 3,000 hours, and that helps with lymphedema, compression, and massage. So she does the whole thing for lymphedema. And then we have another occupational therapist that does lactation. And so she does a lot. It's a little bit different than what Salina has seen in the past years, because her visits are more in-depth, like hour-long, making sure that baby's comfortable, mom's comfortable, making sure that baby's getting latched correctly, checking for those lip ties, tongue ties, and then as well as getting mom ready for pumping and making sure that it's a correct fit. She has the right flange size, because a fun fact is most pumping that you get, the flange size is something like a 24, and most women are actually a size 19 to 20. So when you see JC, you just get a lot better milk supply when you kind of see her. And then we have a fantastic speech therapist as well, and Emily has been working with us for almost a year now, and so she works with all ages of kids with articulation or expression. She does a great job with all the kiddos. And we also have IV nutrition therapy. So what that is IV vitamins directly into the bloodstream. You know, if you take a daily vitamin, only like 30% gets into your body. With IVs, it's all those vitamins 100% into your body. So a lot of people feel really good after their IVs or injections. We also provide nutritional health coaching, and we have Sarah Weedle who does that, and she does food sensitivity testing as well to make sure that there's nothing abnormal going on with your gut that's not processing. And then it's more of like a health coach too. So she really wants to know all of your goals. If it's, you know, making sure time management with your family, you know, well-balanced diet, exercise. She does a great job kind of hitting all of those pieces. And then we recently hired on Sarah Brown, who is a esthetician, and she does facials. Now her facials are all organically plant-based products, so there's no chemicals. Everything is all natural. So she just started that, and it's been picking up pretty well. And I'm trying to think who else we have.
So if someone if someone was in need of some of your services, do they need a referral to come to you, or how does that work?
So some of us do. So for IV, acupuncture, facial, you do not need a referral.
Okay.
Physical therapy, you do not need a referral either, but we always encourage just so we can get on the same communication lines with the physicians as well. But for our OTs and our speech therapists, yes, we do need a referral from the doctor.
Okay.
That's just the quickest way to get services started.
Okay.
Yeah.
And is there any insurance that you accept with your?
We are pretty much almost, I think we're almost to every insurance we are now accepting. So, I mean, that's Blue Cross Blue Shield, United, Sunflower, Providers Care, Aetna.
That's grown a lot since you began.
Medicaid,
Okay.
and Medicare. Yep.
Excellent. So you have a big event coming up and kind of a neat foundation / non-for-profit.
Yeah.
But something that you're starting, and tell us more about that, because that's one of the reasons that I thought it would be interesting to have you here right now too.
Yeah, so Laura and I thought that there was even more that needed to be done in Salina for our community. So we did start a nonprofit organization, and it's called Revive Community, and you can go to revivecommunitykansas.com to kind of look at that. So we are providing some support groups for parents with autism, and if you kind of expand that to overall developmental disabilities or any kind of, you know, struggling parents have with their kids' diagnosis. We do have an event coming up with that, and it's going to be an Easter event, so you can go to our Facebook page and check out when that is. So we really thought that there's a big population in Salina that just needs support. So that is these parents and these kids with some developmental disabilities, as well as some postpartum and breastfeeding support. So we've kind of started those groups already, and now we started this nonprofit to kind of really enhance that and try to get more funding out for those kids to purchase equipment for them. And then there is like a big gap of kiddos that don't qualify for Medicaid. And parents are in that middle ground boat where the kids really need services, but they can't really afford the services. So this nonprofit is really going to be to create some scholarships to help pay for their physical therapy, occupational therapy, speech therapy services when there is that gap for that middle income group as well. So our first event that we're doing is a huge fundraiser, and the big thing we're trying to fundraise is for our sensory room.
Okay.
The sensory room.
And the sensory room will be at Revive.
Yes. Yep.
Okay.
It'll be at Revive.
And tell us where Revive is.
It is at 645 East Iron Street on the corner of Oakdale and Iron. So it's in a brick building. So it's got some space to it. But yes, so we're trying to do a sensory room, and the sensory room will have like swings, a foam pit, and some different equipment that can really help regulate some kids that are high sensory needed. And this will be a place that us therapists will be working with kids, but then parents will come for these support groups.
Okay.
And have coffee and donuts and talk and get together. And then we're also providing free birthday parties for kids with these high sensory needs that they can come and have their birthday party here.
What age range are you looking at there,
Yeah,
do you
so,
think?
I mean, we do treat all ages, but our primary is, 3 to 18.
Okay.
That's our primary age group right now, just because there is another group here that does the 0 to 3. So
Okay.
we mainly do the above 3 and above.
Okay.
So, yeah.
And so what's the big event?
Yeah, so it's going to be on April 27th at Martinelli's. It is a dueling pianos event, and it's the 1920s kind of Great Gatsby theme. So costumes are encouraged.
Okay.
So it's going to be a good, fun event. All money that's raised is going to go towards the sensory room, as well as if there's extra, provide scholarships, start to build that fund. So first step is sensory room. And then over the course of the year, when we get some grants, would be going to develop these scholarships. So, yeah.
So today I would like to be I'm going to be donating some money to start that scholarship fund to you. And I think this is a fantastic need. Oftentimes I know it's frustrating. Even though Salina is a fairly good sized town, we don't have the resources that you have if you live in the larger metropolitan area, like the Kansas City area, or even in Wichita and Sedgwick County. So I think a real need has been identified, and I think it's fantastic that you're taking, the wheel and addressing a need that exists.
Yep.
And sometimes you feel like you are kind of up against a wall when maybe your diagnosis isn't severe enough and or your income disqualifies you from getting assistance for what your children need. So I think that's fantastic. So how many patients I guess everybody sees a wide variety of numbers per week or per month.
Yeah, it kind of depends on the provider.
Right.
So my visits typically range from 45 minutes to an hour. I do some 30 minutes. So I see anywhere between 26 to 35 a week. And 35 a week is quite a bit for me just because I have some of the administrative stuff that I have to get done. Our OT is probably closer to that 35. And then our speech therapist, she does 30-minute appointments. So, she works, 3 days a week filling that spot. And so we're hiring if anyone's a PT or OT.
Okay.
We do need some help. But, so we're just, we're growing, like you said. I did my clinical in Chicago, and they had a fantastic pediatric facility. So that's my goal. And starting with 2, like Laura and myself, just young women, and we didn't have, started with our own money. So it's just growing.
That's great. That's great. Well, Shayla, thanks for coming in today. Yeah. You're very impressed. You've always been a very impressive young woman who sets her standards very high. And I'm so proud of you and your accomplishments, and so grateful that you've come back home to where you grew up and can offer such professional and personal experience for those who need the services that you have, and that you also are so mindful to your employees that you want to provide a good career opportunity for them, but you also want them to be able to have that good balance with their family and raising their own children.
Yeah.
So you're a real asset to Salina, and I thank you for coming in.
Well, thank you for having me.